Hi, my name is Kathy Smith. I'm a physical therapist, and I'm going to be treating a patient who had an MBA, was struck by a car, a police officer, and has some problems with hip range of motion after a femur fracture. So I'm going to begin with the hip. I'm going to start with hip extension, and to increase hip extension, I'm going to do a posterior anterior glide with extension. Now this person is limited about 50% of extension, so it has about 10 to 15 degrees available. I'm going to go ahead and start kind of just bringing him up to his limit here. I'm going to try to come as close to the joint line as I can, and I'm going to do a grade 3 and a grade 4, as this patient's limitations are mostly stiffness versus pain, so it's a clinical group 3B. So I'm going to start with a grade 3, and I bring him into his limit of extension, and I'm just going to go ahead and, using my body, I'm going to bring him into extension and do a posterior anterior glide through the range. And then I'm going to do a grade 4, so I'm going to go up to the limits, into the limits in a small amplitude. So grade 3 would be through range to the limit, and then a grade 4 would just be into that limit. I'm trying to use my body to move the joint. Okay, thank you. Okay, now I'm going to work on the patient's abduction. So he's again lacking about 50%, so he's probably got about 20 degrees of abduction. So I've got him supine, comfortably abducted. I'm going to have my left hand under his knee, my right hand spring under his ankle. And I'm just going to bring him to his limit, and then I'm going to do a grade 3, which would be just kind of through the range to the limit, large amplitude. And then for a grade 4, I'm just going to bring him to the end of his limit, and I'm going to try to do small amplitude into the limits. And so that's a physiological movement. I may try to add, might bring him to his limit, try to support him. I may try to add an AP glide to the hip as well. So a grade 3 would be into the limit, or up to the limit, large amplitude through the range. And then a grade 4 would just be a small amplitude into the limitations. Thank you. Now, the patient's limited in internal rotation, so to work on that, I'm going to bring him into hip flexion with his knee comfortably flexed. I'm going to try to bring him into his limits of internal rotation, which for him is probably about 45 degrees, about 50%. Okay, I'm going to grasp my fingers down approximately on his femur. And I'm going to try to bring him to his limit of internal rotation, and then I'm going to do a lateral glide this way. So grade 3, large amplitude. 4, 5, 6, 7, 8, 9, 10. And then I'm going to bring him to his end of his limit. I'm going to work into the limit for a grade 4. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So that would be a lateral glide at the limit of internal rotation to help improve that motion. Thank you. Okay, so now we're going to do some knee mobilizations on our patient who is a police officer who got hit by a car while assisting another driver. And she had some ACL tears that were repaired. She's now 8 weeks post, and she's got some stiffness. She's limited about 25% of full range. So I want to gain some flexion. So I'm going to do some AP mobilizations to her knee. So with her kind of relaxed here, and I've got her supported on a bolster, if I were going to do just assessing her range, I'm just going to see how her range is and where her limits are. So if I were to do a grade 1, it would just be barely moving my hands, using my arms in an AP direction. And then if I was going to go into a grade 2, it would just be through the pain-free range without stiffness. And then a grade 3, I'd go to the range. And then a grade 4, I would go into the stiffness. It'd be small amplitude into the stiffness. So since she doesn't have a lot of pain, and I know this because she's taking NSAIDs as needed, I'm going to go ahead and do grade 3s and grade 4s. So grade 3 would be into the resistance with large amplitude movements. 7, 8, 9, 10. And then my grade 4 would be into the resistance and small amplitude, so it'd be more of a 3, 4, 5, 6, 7, 8, 9, 10. And even though my thumbs are over here above the joint line a little bit, my hands are actually grasping the tibial condyles. And then I check her for pain and make sure she was okay. Thank you. So now we want to increase her knee extension. Again, she's got some stiffness in her knee and she's limited about 25%. So I'm going to do some posterior anterior mobilizations. And so what I'm going to do is I'm going to stabilize her on her femur. She has kind of a smaller leg, so I can use a pulling technique. So I'm going to assess her range and just see what her availability is. So if I were going to do a grade 1, I would just barely pull up on the proximal surface of her lower leg, the joint line. And grade 2, I would just work up to the resistance. In a grade 3, I would move into the resistance, right up to it. Large amplitude. And then with a grade 4, I would bring her up to the resistance and perform small amplitude movements. So what I'm going to do is I'm going to stick with a grade 3 and grade 4 for treatment for her because pain is not limiting, the stiffness is limiting. So a grade 3 would be that posterior anterior movement, large amplitude. I'm trying to use my body to rock a little bit. And then a grade 4 would be small amplitude. I bring her into the limits of resistance and do small amplitudes at her end range. I'm trying to stabilize her at her femur, my proximal hand. Okay, and that would be for knee extension. Thank you.